All right. Well, hello, and welcome to Intercultural Spark, that show about the spark inside you that sparks you to drive change in the world through mission driven businesses and life projects. I am your host, Deanna Schaas, and today we have a special pre recorded show. So if you have any questions as you're watching, still go ahead and put those in the comments, and we will follow up with our amazing guest, Dr. Tamara Beckford. So, Tamara actually is an emergency room doctor, but she also is a wellness speaker. She is the host of the podcast Docs Who Care, and she is creating an entire health and wellness community behind the idea that you are caring docs. So, we're gonna hear all about it today, and welcome to Intercultural Spark. And thank you, and welcome to Dr. Tamara Beckford. Hi, how are you?
Hello, hello, hello. I'm doing very well. Thank you for having me. I'm so excited.
Oh, my pleasure. And I'm excited to catch up with you because, we always talk to business owners. I believe that micro entrepreneurs, like people who have these vision for businesses that are
Mhm,
doing all this great work in the world, that it's like this grassroots movement that's going to save the world because people have great ideas. And,
mhm.
a business is you have to have an idea, and you have to have an idea that someone will pay you for. And when it's mission or kind of based on your heart and your passion, I feel like it just can go so far. So,
Absolutely.
yeah.
Absolutely. Yes, absolutely. Mission driven, because when it's mission driven, even when it appears that it's not going right, like you have this compass inside of you that's still pushing you to go. So,
Mhm.
absolutely, for yay for mission driven entrepreneurs.
I feel like the same way, you're right, because you always have a core to go back to.
Mhm.
For you, and actually I always put when I put my branding up, I feel like I should be the one sitting under my logo, not you. So,
Mhm.
um, tell me though, because just what it actually means to be an emergency room doctor. So you're based in Houston.
Houston.
Can you just give context for that though? Because that feels like it would be a gazillion hours and just really hard work.
Yeah, no, it is hard work. It's hard work getting to this point. And
Oh, sure, I can
emergency,
only imagine,
just a little bit of work getting to that
Wow.
point.
Mm,
However, emergency medicine is one of those specialties where you have the honor of taking care of everyone, irrespective of um, race, irrespective of age, respective of if they can afford to be taken care of or not.
mm,
And it's one of those aspects of medicine where it's a truly, like you said, a mission driven
mm.
part of medicine. Anything that comes in through the door gets treated. And
Well,
that's
people are
what
at
we're
their most
trying.
vulnerable at that point too.
Absolutely.
Oh
You're
my
at the most
gosh.
vulnerable portion
Mm.
of your life because most of the people who come to the emergency department do not really want to be there.
Yeah,
And
I
they're
don't think so.
right, absolutely. And when they're there,
Oh,
they're at, like you said, the most vulnerable portion. I am someone who you've never met. I mean, you might see
yeah.
me today on, Intercultural Sparks, but on the street, like you don't know me. But then when you come in front of me in the emergency room, you have to tell me your deepest, darkest secrets to
Right,
someone
and
you
and and
don't
not me,
know.
but I'm sure other people have really embarrassing things sometimes, depending
Absolutely,
on what hurts or what's out
absolutely.
of place.
But then you have
Yeah.
to connect
Uh-huh.
so quickly to put the person at ease so that they can give you all the info so that you can take well um, and excellent care of them. So that's the one of the beauty of emergency medicine. So even
Mhm.
a lot of us, you might not believe it, but we're kind of introverted at times, but people are like,
Oh, interesting.
yeah, but we really love connecting and taking great care and thinking on our feet. It's one of those types of medicine where everything might not go right, but you have to be quick. and think and let's because especially if you're dealing with a trauma situation or
I
a
was gonna say you
situation.
have to be quick, and there really is, like,
Yes,
life and death on the
it
on the
is.
line,
Yeah,
for
so you have,
sure.
you have to
Wow.
connect with the patient, their family,
Mhm,
everything. Think quickly on your feet in order to
mhm,
give the best care that you can.
mhm,
So that's one of the beauty of emergency
mhm.
medicine. Now,
Now
go ahead.
oh, I was gonna say, so it sounds like and I'm thinking you also can't take things personally because people can be very emotional when when they're in that situation. But
Mhm.
you had talked about so what are some of the what's the part you like best, and what are some of the skills now that you're hoping to transfer as you turn to open a business? Like, what's the connection? Tell us your evolution.
Lovely. I love
Mhm,
that question. So, as I think about some of the skill sets that you have as an ER doctor, the
mhm,
first skill set is you have to assess the person very quickly and you
mhm,
have to connect with them, which is something that you need to do in
mm,
business, right? Like
mhm,
if I'm here and I'm talking to you and
mhm,
I cannot connect with you, the first thing you're going to do is walk away. So
mhm,
you have to be able to connect with the person, and then you have to be able to pull from them what it is that they need,
mhm.
which is also another.
And they don't always people don't always communicate what they need. I find that to be
Absolutely.
very common. People will say, "Oh, I think I need this," but if you dig down a little bit, it's
Yes,
often something different.
absolutely. So
Mhm,
listening to the patient tell you things in their words, and
mhm,
and that's exactly what occurs. You pick up on one aspect of the statement, one aspect of the story, and then that's actually what they truly need. But they've told you a really long story to get to that one
mhm,
part. Because even while they're doing that dialogue, they're trying to figure it out. But your skill set is to figure it out with them or to bring to light something that they never thought
oh,
about.
that they hadn't looked at it that way because you can look at it differently.
Absolutely.
Mhm.
Absolutely. So those are another great skill set that I love transferring from emergency medicine.
Okay. So
Mhm,
so now you're building this community, the You Are Caring Docs.
mhm.
What is it? Because I imagine for you yourself, I mean, you are caring, you probably need some love yourself after
Mhm.
being, all the
Yes.
intense work that you do. Does it stem from that idea of caring for yourself?
Yes. So your Caring Docs, they're like I said, it's a health and wellness platform. So
Okay.
the aspect of it that's really important that I had to learn, as you mentioned, is the care for self before you can care for others. And it
Mhm,
might sound oxymoronic because it's like, well, aren't you a doctor? You're taking care of other people. Are you trying to tell me that you don't want to take care of me first? You want to take care of yourself
mhm,
first? But I mean, it's the same
mhm,
adage, a motto, and that which you hear when you're on the airplane. So once you're putting on the oxygen on yourself, now
mhm.
you're not going to pass out from the lack of
Right.
oxygen. So you can now take care of everyone else. And that's the premise around the Your Caring Docs. Like we are trying to implement and to show people that self care is not selfish. Self care
Mhm,
is part of your well being, and it actually
mhm,
affords you more opportunities to take care of everyone else or to do other things that you're really passionate about by really focusing on yourself initially, and then you'll be able to give out. Now when people hear that self-care and you're like focus on yourself, it really, it's challenging for someone to think about it because it sounds so
mhm.
against everything.
Well,
And
I
it's
think it's challenging. It depends on the person. It's very challenging, I know, for people
Mhm.
in the caring professions.
Yes,
So,
especially
especially
that.
therapists, doctors, people that are used to
Mhm.
always assessing and caring for others.
Because we're
Mhm,
in an altruistic environment, and that's what we've been taught.
mhm,
Give, and the more you give, the better you are. If you think about even our training and even the way that society treats us, you're a hero because you went the extra mile.
mhm,
You gave until you passed out, and we're
mhm,
going to give you a reward. But then, what we should be highlighting is let's keep you well so
mhm.
that you can give more,
Mhm.
right? So
Well,
that you
certainly with the
can give.
pandemic, there's been all kinds of things of caring,
Absolutely.
but sometimes it's physical things. I understand, like, the level of stress around being, let's say, an emergency room
Mhm.
doctor over the pandemic. What's that been like?
So that has been a very challenging period within healthcare
Mhm.
overall. So even as an ER doc, during the height of these waves, which wave now even have a new meaning, right? Before we were
Mhm.
talking about the beach, now we're like, okay,
Mhm.
surges in
Mhm.
the viral loads and the amount of people who are getting sick.
Actually, do you have the scoop? I keep hearing, like, are things open or closed? Are we getting another wait,
I know,
let's
right?
break for a minute
I
for,
would
like,
say that
breaking
we're
news.
ajarred. Ajarred is where we are. I
Uh,
mean, we're ajarred in that, yes, the pandemic is still here. People are still getting sick, but it's still important to adhere to all the safety guidelines.
mhm.
But yes, you can move around now,
Okay.
especially at this particular recording on this particular day. The viral, no, it's true, right? We
Mm,
are, it's the Omicron, we're on the the lower end. The
mhm,
curve is on its way down, which is grateful because it is springtime and people want to be renewed, refreshed, and they're really ready to get out of the house.
mhm.
So that's a
Oh my gosh,
beautiful
for
thing
sure.
at this particular recording. Now, at the height of the pandemic, when we're having
Mhm.
lots of surges, as an ER doc, it was very, very challenging. I'll tell you, even the one of the most challenging part was the beginning, because we had no clue what was going
Yeah,
on.
we just didn't know what was coming or how serious, I mean, it was. It was
Absolutely.
very serious for a lot of
But
people
then the
too.
thing is, though, as an ER doc, your role was not to stay home until the surge passed. Your role is to go in, despite not
Right.
knowing what's going on,
Yeah.
without anyone knowing what type of virus this is, how does it work.
Mhm.
So you went in despite that. You went in, and you had your family on your mind. You went
Mhm.
in wondering, am I bringing this home? For
Oh,
me,
sure.
my son was a year and a half. I'm wondering, am I bringing it home to
Mm.
him? I had another son who was 3. So, what
Mhm.
you do, you put contingency plans in place. You put together your will. There are a lot of us that went and got to the lawyer, say, okay, last will and testament, let me get this ready just
Oh,
in case.
wow. Mhm.
Absolutely. So those are, what went through the minds of us as the ER
Mhm.
doctors, who were dealing with this.
Mhm.
Now, thankfully, through, science and through a lot of
Mhm.
effort for our population, we're now talking about the doors being ajar.
Yeah, we
So
are.
yes.
It's interesting, I just realized too, we're
Mhm,
pre-recording this, so this will air, people are watching, thank you, on April
mhm,
14th. It'll be
mhm.
interesting to see, what we're saying now and
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 how
how
it
that goes.
changes back.
Do you think so
Absolutely.
tell us, like, a couple of the services or the couple of visions that you see with the You Are Caring docs,
Mhm.
and then I'm curious, like, how much of it actually grew out of your experience of being an ER doc during the pandemic. But tell
Oh,
us more about what it is. If someone wanted to use services from you, what would they be signing up for?
absolutely. So there are two ways. So we have coaching, and
Mhm,
we through the Your Caring Society, which is a group program where we have women who are like-minded. So this is a women. This portion is women related,
mhm, okay,
like-minded women who want to put their health, their wellness first. They want a supportive environment in order to do so. They want to do it without feeling guilty. They want accountability. So that is that part. So that's the subscription based.
okay,
Yeah, that part is subscription based. The second portion of Your Caring doc is the wellness speaking portion,
okay,
where I will go out and speak at events and really highlight some of the importance of self care and
mhm,
how self care can help you on a daily basis, and how even just small tweaks in your self care routine can get you moving from overwhelmed,
mhm,
over exhausted, undermotivated, to feeling energized and being productive. And
mhm,
this is for not just individuals and
mhm,
but for organizations themselves. Because if it's one thing that we've noticed, is that in addition to the great resignation that's going on, there are a
mhm,
lot of people, whether you're a small business or a large corporation, you're just tired. You're
mhm,
tired because you've just been going, you've had this heightened
mm.
level of anxiety for at least 2 years now. I mean,
Right, and even people don't feel it,
yes,
boldly, I think there's just, like, this low level
it's a
underlying anxiety. Yeah.
absolutely. So there are small
Mm.
techniques that
Well, what's
can be
like can
used.
you share, like, what would be one small technique that someone could do?
So
Thank
one of
you.
the best way
Mm.
to start is
Mhm.
to start by gratitude.
Mhm.
Showing gratitude. So expressing gratitude, it's hard for someone who has never done it. It's hard if you feel like you're this machismo person or you're such a hard-lined person overall. Like, why should I start? And this sounds so shishi foo foo, like, oh yeah, but no, but it's such an important aspect to start. If you start your day, and a lot of these techniques are techniques that you start in the morning, you start your day, and instead of you running and getting your phone and looking at social media or checking your email, you just take a few minutes. This
Mm,
can really be 30 seconds, a minute, and just really think about, what am I grateful for? And it's not that, oh, I'm so happy that, oh, it's so nice that. No, no, no. I am grateful for. It changes the meaning, and the
mm.
word changes the entire statement. I'm so happy that I got a red shirt. No, I'm grateful for the opportunity to
Oh,
wear
interesting. So
it.
distinction between being happy and grateful. That I've heard
Absolutely.
actually even people on the show have talked about, just
Mhm.
even a business practical thing to do, which is to
Yes,
not go on your phone the first thing. It's
yes.
hard. I know
It is
my husband,
hard, but
we keep
it's
our phones.
doable.
I'm sorry, say that again.
It's hard, but and it changes
Mhm.
your
Yeah.
entire day. It
Mhm.
changes your
Yeah.
outlook on your day. I call it entering into your day versus having your day enter into
Enter to
you.
you. Makes sense. And
Yeah.
we keep our phones out of, like, we do not keep our phones upstairs. Our phones are a completely separate
Hmm.
spot. So it's almost
Hmm.
like just taking a minute to do that meditation maybe
Yes.
before even
Before.
leaving the room in the morning. Mhm.
Because it changes your mood.
Mhm.
Your mood changes instantly. As soon as you pick
Mhm.
up your phone and you start to move into whatever it is that the phone is, social media, your emails, you get this email from a company that
Oh,
says,
and that
hey,
annoys you. You get an email that just
that
annoys the
annoys you in
heck
the phone.
out of
And
you.
that's the way your day starts. And trust me, once it's there, it is hard to bring it
Yeah.
back down. But once you're starting on a level of control in your environment,
Mhm.
it's hard for them to get you off that control, to get you to be reactive. It's
Mhm.
very, very hard. So that those are important.
Mhm.
But these are tools that, like you said, there's some people that recognize these tools, but there are a lot of people who have not.
Mhm.
And
And is
they're
that sort of who
single.
you're targeting? Is your target also within the medical profession? Because I know with your podcast,
Mhm.
you're doing so with the podcast, you are actually talking primarily with other
Doctor.
medical professionals. Are they sharing some of their challenges, or what are you finding
Oh
that's
yeah.
common among your podcast guests?
Oh, yeah. So we merged some of the information. So some of the guests, they're given information about, medical topics. But if
Okay.
you scroll down even further, they're talking about burnout. They're talking about life as a professional, that things have not worked out for them. So
Mm,
one of the highlights that and feedback, that I get from this, from people who are non healthcare professionals, it's like these people are so relatable, because they'll talk about, I was burning the candle at both ends. I'm a mom, and I was so excited to become a mom. I'm working in the hospital taking care of patients, which is what I've often wanted to do. And then, after the birth of my child, I realized that I had
mhm,
twins, and one of my child has the special needs. So now I'm
mhm,
working full time in the hospital. I have to take time off, take them to their special doctor, and then come back. And I'm, doing charts at home, finishing around 9 p.m., not being able to interact
mm,
with my family. And then I find my life just broke apart. So everything that I thought I wanted has now gone down.
mhm.
So, even this particular one here, talking about being sued for malpractice in
Oh
driving.
my gosh.
Yes,
Wow. So
this is
people
under law
really
enforcement.
sharing stories,
There's
because 'cause you've done quite a
depression.
few of these.
Oh,
And it looks like
absolutely.
a lot of your guests are women and
Mhm.
also people of color. Is that by design, or talk about.
No, it's very multicultural.
Okay.
I have a lot, I do have people of color. I have
Mhm.
doctors from different countries. I've had one of my doctor from England, from Tokyo.
Oh,
It's
wow.
really, yeah. So a lot of during Black History Month, I tried to highlight a lot of the African American doctors
Mhm.
there. But yeah, it's very multifaceted, and you just
Fantastic.
yeah, but it really highlights how, as a person, how human we are, who we're humans, but we just so happen to practice medicine. Like one of the last one you
Mhm.
see there is Dr. Elisa Chang, and at the bottom I'm talking about, like, the FIRE movement, which is financial independence and retiring
Okay.
early, about how important it is to be so financially independent, to think about
Mhm.
these aspects of our life.
Mhm.
Because one of the things that people didn't even realize is during the pandemic, a lot of doctors were getting fired. They were being furloughed. Some doctors were having to go on and get checks for unemployment.
Mhm.
And
No, actually, I didn't realize that. I guess because it seemed like there was such a need for doctors, although I would
absolutely.
say just the way the whole healthcare system is changing, that changes for
Mhm.
doctors. Because it used to be, getting, being a doctor just automatically meant you were set for life,
You were
and
set for
now,
life, right?
yeah,
So
it's the way
because of
insurance.
those rhetorics, that's
Mhm,
how the Docs Who Care portion, that
mhm,
podcast portion, really allows those who are on the other side of healthcare, the other side of the curtain, for you to understand what's going on in these physicians' lives. Because when you are saying, wow, you were feeling the same despair that I felt, like Dr. Lisa Chang, she's like, yeah, I just got
mhm,
fired. Like, I am no longer, I got
mm,
fired. And luckily I upheld these certain small practices of being in order to not worry. These are some of the small techniques that I've done. And I'm not rich, because everyone
mhm,
thinks you're a doctor, you're automatically rich, but no, these are some techniques that are part of your self-care, which is, have you taken care of your financial part of yourself, right?
mhm,
Have you been putting money aside? What is important to you? What's important? Is traveling important to you, or is it having
mhm.
fancy
And that's
items
what she
around you?
talked about on her episode.
And
So
her,
do you find that your podcast and actually just the You Are Caring Docs, is it actually for people? I think you said this before, but it sounds like then there's really things specific to people in the healthcare, in the
there
caring
it's a
profession that
it's not just for, no, so it's not just for healthcare professionals.
Mhm.
It's for people overall. The Your Caring Society is for women, but it's not
Okay.
only for women in the health profession. So I've developed a society to help women who are professional women, but they're not just healthcare professionals. So
Okay.
if you're a teacher, you're a small business owner,
Mhm.
you want to be around like-minded women who are all know that it's important to take care of ourselves, but find it so hard to do so. So you said we're in a society together, that we're going towards our dreams, and
Mhm.
we're evolving at the same time. So it's so important. Interestingly, one of my clients called me today, and she said, I just had to tell you this, that I've realized that the evolution of my self-care has been the evolution of how I am approaching life overall.
Mhm.
So each time I'm adding something to my self-care routine, I'm noticing things around me, and then I'm moving, progressing in life. She's moving to a better job. She's
Mhm.
moving, and these are things that she said I would not have done this had I not really recognized how important self-care was, because in doing that I recognized my value. And then I
Mhm.
was like, so my value is now important to me, my time is important to me, and I move on, and my life is improving overall, like a complete balance, which is something that unfortunately doesn't happen when we're just focusing on just external things.
Mhm. And
So,
how have you seen that evolution in yourself? Because I think you're
oh
still
yeah.
working, you're still
Oh,
the
yeah.
full-time doctor, but I know you want to pivot and build, you're
This
looking at
business.
how you build the business. How are you seeing this evolution in yourself?
A wonderful question.
Mhm.
I'll tell you that over 2 years ago, prior to me venturing into this, I was one of those people. I recognize, and this might sound crazy for others, because you're like, well, you're a doctor. You felt like, haven't you reached that point in life that you have figured out what it is that you want, that you're doing everything for, for that particular career?
Mhm.
I was doing it with a career, but the meaning was a little bit different. Once I started to embark on self care and learning little techniques, as I said, improving my mindfulness, improving the way that I think, my outlook, recognizing how my mind works, and recognizing that my mind will put out negative thoughts, but I do not have to believe everything my mind
Mm,
tells me. I've seen a growth. Within the emergency room, as we said in the pandemic, there are many physicians who have burned out
mm,
because of these small little changes I made within myself. I can say with confidence that I was not one of them. It is so
mm.
noticeable that one of my medical director asked me, he said, I've noticed that you fared so much better than a lot of your colleagues during
Interesting.
this period. And I said, yeah, because I had, the meaning was more than me, but
Mhm,
I learned to start with me, and all the techniques that I've used in order to get through this pandemic, knowing that I had an infant, knowing that I had a
mhm,
toddler, I have a family. My in-laws were with me, and they're over 70 years old. So all the populations that were really at risk, I was going and taking care of them and coming home and knowing that this was in my home. I was able to really use these small techniques and still stay afloat, and not just survive, but I
mm.
thrived. My
Well, it
mind
sounds
was
like what you're
able
doing
to.
has to be working because even just being the sandwich generation, I'm like actually like physically getting stressed just thinking about having the baby, having the parents, being in the emergency room. So you have to be doing something because all of that combined just
Absolutely.
sounds incredible. So for people who want to connect with you, they would as part of as so if people want to find out more, become part of the society, and you meet as a group and then also one on one.
So we'll meet. No, we usually meet as a group,
Okay.
and I have wonderful guest speakers who come and speak on health and wellness topics. So
Oh,
I have
nice.
that every other month, and
Mhm.
then the months in between, we meet as a group, and then every 2 weeks, we just knock out a quick little jump, keep ourselves motivated.
Okay.
Yeah, so just for a quick 30 minutes, how can we help you? What are some of the things to get you motivated and to continue, get you over the hump? But the most important part of that is a safe community of women who are supporting other women. It's
Mhm,
a positive environment. And it really just, there's nothing more, I think, rewarding than being around positive people who can help you
mm,
become the best
sure,
version of yourself.
mm. And what's your vision? So what's next with what's your vision, let's say a year or so from now? Where do you hope this will be?
So a year or so from now, I would really hope that the York Caring Society will continue on, and that it becomes its own version of an entity.
Mhm,
Like, it's just such a great society that other women would love to be part of it. We continue on as a society. People either graduate from it or decide to come back and meet, but it maybe even help be coaches, and continue building,
mhm,
because you've learned
sure,
so many techniques that it says, okay, I can make a little different small groups from it, that's led by wonderful coaches. In addition to that, with the docs who care, I didn't even realize how wonderful and honored that I was to be led into these wonderful doctors' lives. I would love to be able to continue to build upon that, and then start to honor these doctors in
mhm.
different parts of the
Are you talking
country.
about everyone who's been your podcast list is amazing. I mean, the topics are phenomenal. So it
Oh
really is
yes.
wonderful. So Tamara, we have gotten to the part of the show, which
Mhm.
is our flash exercise. So
Ooh.
the flash exercise is,
Mhm.
oops, it's a double flash exercise today. The flash
Yes.
exercise is an exercise because I also, so one thing that I do to try to not go completely crazy is also a group fitness instructor. So nobody calls it aerobics anymore. That tells how old I am. I teach aerobics. And I always pick an exercise that I picked
Mhm.
specifically for you and our show. I'm going
Okay.
to make me full screen for just a second. I'm going to show you the exercise, and
Hmm.
then I'm going to let you guess why I picked it for you. It's always an exercise that you can do. That you can do at your desk. So this is a core strength exercise for your
Okay.
abdomen. And what
Hmm.
you do is your feet are flat on the floor. What I'm going to ask you to do is bring your. It's hard. To, oh, and you can see I'm dressed in my exercise
Hmm.
legs. So you're going to bring your knees to your chest and then bring them back down. It's actually hard to do. So if you
Oh,
want to, you can always modify by doing one leg at a time. Otherwise, you're going to bring both legs up and then bring them down. So you squeeze and down. I'm going to make you on back on screen with me and see. So are you doing it under the screen? So you lift
so
both legs and
both
down.
legs and down.
Yeah. So you can feel it. It's a really,
It's
it's
a
a
core building
core
exercise.
strength. Yep, you can feel what it does. Do you have any guess why I picked this exercise for you?
Because I have to sit for long periods of time.
That could be. Here's what I was thinking, that
Hmm.
what you do, like the emergency room, and you've got a baby and a toddler and your parents, that by all intents and purposes, you should be in the corner in the fetal position.
That's true.
Okay. However, because of your great process, you're standing up straight and you're
Yes,
thriving in the face of everything you have to do.
I
So
love
that's
it.
why.
I love it. It really it speaks to the core of what
Oh,
goes
good
on.
one. Good
Yes,
one. I'm sorry. That little known genre, not only of interpretive aerobics, but in aerobic humor. Thank you.
yes, I love it.
Yeah.
Absolutely.
Yes. Well, thank you so much for joining me. This was fantastic. I wish you so much luck with everything that you're doing, and we'll continue to take a look at your podcast and everything. And for everyone else, we will see you next week on Intercultural Spark. And again, because we were pre-recorded today, if people have questions or we didn't cover something, just put it in the comments, and I'll circle back with Dr. Beckford, and we'll make sure we get your
Absolutely.
that we get everything answered. So, all right. Thank you. And we'll see you next time.